Welcome to VidZet. I'm Dr. Ted Noel. As Congress moves to repeal and replace ObamaCare, we should take a moment to consider what would ideally take its place. Unfortunately, before we even start, Senator Harry Reid, on his way out the door, said,
"Let's have a few people die, because that's what will happen. You get rid of Obamacare, people are going to die."
Fortunately for us, Senator Reid is simply wrong. The Oregon health experiment has shown very clearly that if you have insurance, it doesn't make your health better. If you don't have it, it doesn't make it worse. There's no effect on mortality, and health insurance raises cost. Funny, that's something we've been talking about with the law of subsidy. Since health insurance as a deductible expense is a subsidy to healthcare providers and to health insurers, you would expect to get more and to have it become more expensive. Let's look at the principles that should govern any replacement. First, it should increase freedom for patients. 2, it should increase freedom for caregivers. And 3, it should make the market for health insurance the same from Utah to Florida to New York and wherever. The northeastern states are famous for having all sorts of extra things that you have to get in order to get health insurance, and that drives up the price. But suppose you live in New York and you're 50 and you don't want to pay for OB coverage and you don't want to pay for whatever else frilly thing that they've thrown in. Guess what? You can go to Oregon or to Colorado or New Mexico or wherever and get a policy that sells just the coverage you want, and you'll pay a lot less. Congress has the authority under the Commerce Clause in Article 2 of the Constitution to make that happen. The next thing is get rid of all of the mandates. All of them. The mandate to buy insurance is a subsidy to the health insurance companies. There is, as the Oregon experiment showed, no health benefit to having health insurance. So why would you force somebody to buy it? The next thing is no mandates, like the northeastern states love to do, requiring you to buy XYZ coverage. Let people buy just what they want in terms of coverage or what they think they need. They can find a policy at a better price than the government could ever require. The next problem is the pre-existing conditions mandate. As we discussed in another video, this is a bad deal, and it is a way of just ripping off insurance companies and making sure that they have no way to pay their way. They cannot survive as long as we do that. Now, it is a problem that has to be dealt with. There are some people who have these horrible situations. They are a small minority, but they're real. And we don't want to be totally insensitive to that. So there are methods that can be used. High-risk pools, for example, have been very successful in similar situations. But why should the federal government be the one to lay it out? Why not let the various states figure out a way to do it, and then when one way is successful, let other states find a way to copy it? One thing does properly belong with the federal government, and that has to do with the tax effects of health insurance. Now, ideally, we would get rid of the deductibility of health insurance completely. That way, if people were buying health insurance, they would make a proper economic decision, and the subsidy to health insurers and health providers would go away. But not being able to get that through this time, let's look at one other choice, and that's called a health savings account. Now, health savings accounts have two parts. The first part is high deductibles. But what happens is, let's say there's a $5,000 deductible. Part of the premium puts $5,000 right there so that it can be used to pay for medical care, for office visits, for whatever else. And then the second part is high expense coverage. That is, that expense over $5,000 is now covered 100%. It actually looks like 100% coverage at one point, But at the end of each year, if let's say somebody spent $2,000 out of the five, so they've got $3,000 sitting out there that they haven't spent, let that sit there tax-free. Let it accumulate tax-free. They can spend it as a lump sum. They can spend it for little things that they want, or they can hold it there and let it grow like an IRA. This creates an incentive for people not to use health services. And remember, the Oregon experiment showed this doesn't change outcomes. And anybody who's worked in an emergency room knows that people who have 100% coverage overuse healthcare. So let's put HSAs out there for everyone. Just to extend my comments on HSAs, there have been experiments done with HSAs and Medicaid, and we've seen much less usage. We've also seen it in private insurance areas, and typically health savings accounts will reduce health risk experience, that is, the actual going to doctors, the going to hospitals, by about 30%. That cuts costs a bunch. Now, there are a couple of other things that we want to look at. The idea of keeping kids on their parents' plans till age 26. Why should that be a mandate? Certainly, there would be companies that would say, you know, we want to attract certain clients, and so we'll write a policy that lets that happen. But what about the guy who hasn't got any kids? Shouldn't he get a cheaper policy because he doesn't have any kids he wants to keep on till age 26? Why do we have to have a mandate? There's no reason for it. What about the classic anniversary date? Every policy in the United States seems to expire on December 31st and renew on January 1. Why does that have to happen? It makes no sense at all. Why can't we let them, for example, expire on your birthday? That means that the companies would be looking at changes happening all through the year, and they could adapt on a progressive basis and say, well, we've got this new one, we can start trying this, perhaps in the middle of July or August, we can start trying something a little different and see if it works better in the marketplace. All of these things could happen if we got rid of the New Year's Day anniversary. And like I said before, the ultimate reform would be to eliminate the tax preference status of health insurance. Get rid of deductibility. Make it part of an employee's salary, not a fringe benefit which costs less because it's sitting out there in the employer's side of things. Make it all part of his, let's say it's $1,000 a month. Put that $1,000 in his paycheck. Make him pay the $1,000. Maybe he'll buy something that's only $800. But since it's out in his paycheck and he's only paying $800 now, guess what? There's a $200 subsidy. Get rid of all of that. Like I said, we need to find ways to cut costs. And the first way to cut costs is to cut subsidies. The second is to cut mandates. What we are doing with all of this is to legalize freedom. And freedom works every time it's tried. I'm Dr. Ted Noel. Thanks for watching.